All right, good morning, everybody. Thank you very much for joining us for our press briefing. We've got a lot of information here that we're going to be covering today, so please be patient as we work our way through all of this. But as always, we're going to remind everybody about the importance of continuing to slow the spread of the virus here as we combat this pandemic, doing things like staying that 6 feet of distance between you and other people, wearing your mask when you go to the store, washing your hands often. And then last week we kicked off at the state level, our local public health directors have already been doing this, but kicked off the 3 C's campaign: avoid crowded places, close contact, and confined spaces. Those are all opportunities for the virus to spread. The virus is spread from one person to another. It's a respiratory virus. So if you are going to be in those situations where close contact, closer than 6 feet away, it's a great idea to wear a mask. And I see you're all doing that, so great job, everybody. You already started off the week doing the right thing. Hospital capacity. This is why we announced the additional updates to the DHMs last week. It's to preserve our hospital capacity. We've got 38% of our hospital beds available today, 37% of our ICU beds available, and 78% of our ventilators are available. So we want to continue to make sure we have that hospital capacity available for people who need it when they need it. So please remember that. The reason you're wearing that mask or washing your hands or keeping that 6 foot of distance is to preserve that hospital capacity. And it works not just for people who have coronavirus, because actually, if you look at, it's less than 10% of the people in our hospitals have coronavirus. But if there's no space at the hospital and somebody has, for example, a heart attack, that can create a problem. We don't want to see that happen. So please make sure you preserve that hospital capacity. You're helping keep everybody safe. All right, Test Nebraska is another way that people can make sure that you're fighting the spread of the virus. Over 330,000 people have been tested. We've had over 1.2 million assessments, people going back in and updating their health data. And we are working to be able to get the turnaround times down. And in fact, since October 13th, we've got a turnaround time of about 48 hours. So we are hitting our stride there with regard to that. We're going to have to continue to stay on top of it and manage it. But our goal is to be able to continue to turn those tests around in a timely manner. All right. So, and again, just got our 3 C's board over there, which I forgot about. If you guys would pan the cameras over there, go look at our 3 C's. It's a great graphic. All right, but before we get into using our fancy coronavirus relief funds, we've got a couple other things we want to talk about first. First of all, October is also Pregnancy and Infant Loss Awareness Month. If you look at the data from the CDC, they will tell you that about every year, about 1 million families experience a miscarriage. And about 25,000 will have their children born still. And then another 25,000 families experience the loss of that infant before they're 1 year old. And of course, this is a devastating tragedy for all those families. The statistics are that about 10 to 25% of every clinically diagnosed pregnancy will end in a miscarriage. And those families need support. And so today we have an organization, No Footprint Too Small, that is here today to talk about the support they offer those families and those women who've experienced that loss, whether through a miscarriage, through having their child born still, or that loss before the first year of their life. I also want to thank, we also have here today the Knights of Columbus from Hebron, Jim McKinney. Jim, where are you? Jim, raise your hand. Good job, Jim. Thank you very much for your suggestion on helping to raise awareness for this, to make sure that people know there are resources out there and that we're honoring the loss of these young lives and remembering them as a way to not only remember their presence here on this earth, but also acknowledge the need of the families for that support. And that's, again, one of the reasons why we have No Footprint Too Small. Now, back in 1988, President Ronald Reagan did the first Pregnancy and Infant Loss Awareness Month. And so today I'm going to sign a proclamation that will do it this year for the state of Nebraska, make it National Pregnancy and Infant Loss Awareness Month. And so I'm going to sign this proclamation to help raise awareness here in Nebraska. And then I'm going to call up Chloe Zabel and Jolie Vega, who will talk a little bit about No Footprints New Small, which is a Lincoln area nonprofit that provides services and support for the families who have experienced this. So Chloe and Jolie, I don't know how you want to work this. Who wants to come up and accept this? We'll take a quick picture with this, and then you can talk a little bit. All right. All right, and I'm going to just leave this here for you.
Great, thank you.
And then I'm going to find a place to get out of your way. How about we go back here?
Good morning, and thank you for allowing me to share my story. My name is Chloe, and I am a mother to 3 babies in heaven and 2 beautiful daughters, along with a beautiful bonus daughter here on earth. My first 2 losses were categorized as early miscarriages. Although I was only able to carry those precious lives for a few weeks, the love I had for them was immeasurable, as was the pain that came with losing them. I still think of and miss my sweet babies every day. My third loss was the stillbirth of our son, Liam. He lived for 30 weeks and 2 days within my womb. My husband and I were over the moon to learn that I was pregnant with Liam in May of 2017. We shared our happy news with our 3 daughters first, who literally cried tears of joy when we told them. They were so ready for this new addition, and everyone hoped for a baby brother. My 2 prior miscarriages taught me how to appreciate each day with Liam. I was grateful for the nausea, the heartburn, my growing waistline, and each painful jab to my ribs. They were signs and confirmation of the life that I was growing inside of me. At 21 weeks, we went in for our big ultrasound and found out we were indeed having a boy. Although another daughter would have been just as welcome, we were thrilled to be having a son. That appointment brought more than just good news, though. Our ultrasound revealed abnormalities to his placenta and umbilical cord. Because of this, we were referred to a high-risk doctor. This doctor went on to confirm and diagnose me with placenta previa, placenta accreta, and vasa previa with velamentous cord insertion. These conditions brought risk to both of our lives. For our safety, the plan was to be admitted to the hospital at 32 weeks and deliver Liam by C-section at 35 weeks. I would also have to come to accept that I would require a hysterectomy at the time of his birth. I was 31 years old. While dealing with all of these scary things, though, I remained asymptomatic, and even better, Liam continued to thrive. We had every reason to believe that we would both come out on the survivor's side. November 8th, 2017 was the day that our family changed forever. It was on this day Liam suddenly stopped moving, and we were told the words that no parents ever want to hear. "I'm sorry, but I can't find a heartbeat." We later came to find out that he died from a nuchal cord accident. The following day, I delivered Liam. He was 3 pounds and 4 ounces of pure perfection. Thanks to a device called the Cuddle Cot, our family was able to take the time to love on him, take pictures with him, and soak in the sweet details that made him, him. We will always treasure that time as a family. As we approach Liam's 3rd birthday, the grief is still there, and the tears do still come. But I can see now just how blessed we were and still are. God provided us with everything we needed during the most devastating time of our lives. Liam's death is not the end, though. I find rest from the heartache knowing I will hold him and the rest of my babies in heaven someday. Until then, I'm honored to be their mama, share about them, and leave a legacy of love and faith. Thank you.
Today is my daughter Aviana's 5th birthday. When I was pregnant with her, I couldn't imagine such a milestone. The only thing I could imagine, and the only thing I prayed for, was simply getting to hear her cry when she was born. A year prior to having Aviana, I was pregnant with my son Judah. As soon as I saw that positive pregnancy test, I imagined every milestone from the day of his birth to the day he got married. On September 6, 2014, a week after his due date, I gave birth to my son. The room was silent, there was no cry, he was stillborn. I have shared my story a lot over the past 6 years, but today I want to focus more on awareness than on remembrance. I want you to know that my story is not unique. Thousands of other Nebraskans experience pregnancy and infant loss each year. The details are different, but the heartache is the same. As a hospice worker, I witnessed the lifelong grief journey that bereaved parents forever walk on. I heard a 90-year-old man's story of his infant son dying in his arms over 60 years prior. I witnessed a wife telling her husband he'd finally get to meet the babies they had never had the chance to raise. As a doula, I recognized firsthand how sacred life is at any stage during pregnancy. I welcomed babies into this world that were no bigger than my hand, but whose perfectly formed features left me in awe. As a therapist, I am reminded of the trauma women experience, both at home and in medical settings, that result in PTSD symptoms and high levels of anxiety as they continue to grow their families. I am also reminded of how not only the mother, but how each member of the family is deserving of and in need of validation and support. As the founder of No Footprint Too Small, I am aware of the lack of resources and guidance following the loss of a baby, and of the importance of providing comprehensive care to the bereaved. As a mother of the community of birth professionals, I acknowledge that we need to be proactive in regards to women's maternal health in order to improve birth outcomes. And as a bereaved mother, I recognize how thankful I am to be in a room with individuals who recognize and value the life of my son and of the baby I lost after him. And as a fellow Nebraskan, I hope you consider that when there is anything that impacts thousands in our state, the impact is not only confined to those directly affected, but that a profound ripple effect within our communities takes place. Advocate for providing education and empowerment that may prevent pregnancy and infant loss when it is possible. When pregnancy and infant loss is inevitable, help ensure that we are providing quality and compassionate support. Acknowledge that the impact of pregnancy and infant loss is significant, lifelong, and far-reaching. Join me in not only remembering our babies, but raising awareness in honor of them.
Chloe and Julie, thank you very much for being here and sharing your stories with us. And again, please accept my deepest condolences for your loss. And thank you for the testimony here so that you can help other families who have experienced the same thing know that they're not alone, and that there's people out there who understand what they've been through, and there's resources out there to help them. So thank you. And again, I want to say thanks to the Hebrew Knights of Columbus for being here as well, and for your leadership on this as well. Thank you. All right, so next we're going to talk about mental health and civility. Now, folks, we know as we've been through over 7 months now of this pandemic that we've asked people to stay home, stay healthy, stay connected, avoid crowded places, close contacts, the confined spaces. A lot of the restrictions we put in place have had it so that people are not doing their normal social routines. And that has an impact on their mental health. In fact, the CDC, Dr. Redfield, had several months ago talked about how high school suicide rates were actually above baseline and higher than coronavirus deaths for high school students. So we can see that this can have a very severe impact. We also want to remind people that, look, everybody I know is getting tired of this. We've talked about that before. Tempers are getting short, but we do need to continue to make sure that we're being civil to people when we're having our discussions, that we're having a little bit more grace with others as we go about our daily lives, because we know this is tough on everybody. And so here to talk a little bit more about that, I would call up Sherry Dawson, who's our Director for Behavioral Health at the state of Nebraska, to talk a little bit more about mental health and civility, and especially in dealing with the folks who are trying to help us manage through this pandemic. I ask everybody to be able to do that, certainly our educators, our teachers, administrative staff. They're all going through unknown territory here. We have not dealt with a pandemic in over a century, so I ask everybody to be patient with that as well. So Sherry?
Thank you, Governor. And thank you for your heartfelt story. I think it's a great example of people stepping forward when others are having challenges. And that's certainly what we have to do in this time with COVID. We know that fear and anxiety have really been a very common experience for individuals. And whenever we experience fear and anxiety for a long period of time, it can impact not only our bodies physically, our immune system, but certainly how we communicate and our behaviors. And so it's really important that we just take a moment and really talk about coping with stress. Stress can be individualized. Everybody experiences it differently, and everybody's tolerance is different. But the one thing that we want to make sure of is that everybody is taking time for their own mental health. You know, we can do check-ins for physical health. We can get a blood pressure check, we can get our blood sugar check, but it's within us to manage our own thoughts and feelings. And so we have to take time every day to check on that. What are we feeling? What are we experiencing? And with our loved ones and community partners, people we work with, check in with each other as well and help each other when you know somebody seems to be experiencing stress. How do we see that? A lot of times you will see anger, irritability. All of a sudden, somebody just raises their voice, and it's really unlike them. And those are signs of stress. And so we need to check with each other in terms of how to call it to our own awareness. So if you have a colleague that you're working with, it might be okay to say, hey, Sherry, I noticed you're not yourself lately. Or, hey, Sherry, wow, that was intense. Are you doing okay? Each Wednesday in our community-based services, we have Wellness Wednesday. It is a very intentional effort to make sure that we're dealing with our stress and having a little bit of fun. So when you notice that others around you and you, I'm going to ask and challenge you to check your own thoughts and feelings each day. We, in the spirit of the COVID, we try to control things that we can't control. And so we have to take pause and step back and only focus on what it is that we can control. And for some days, that's going hour to hour. Some days, that's going a day at a time and beginning to focus on what we can change. Because if we don't, it's like the example I give is if you've gone swimming and had a beach ball and you try and jump on it and hold it under the water as long as you can, when that baby goes, right, you don't know where it's going, you don't know who it might bump. And so talking about your feelings and having conversations about stress and you being responsible for checking every single day your thoughts, feelings, and behaviors is really important. We all have bad days, but we have to remember that the people on the other end of the phone or the other end of a Zoom call or right in front of us, go with the spirit of good intent. Everybody's experiencing that feeling out of control. We all have bad days. We all may yell. But let's have, as the governor said, begin to support one another, recognize stress and what we're dealing with on a daily basis. I would love if there was a big red button we could pass around that said reset, because there's days where we just have a bad day and we just have to admit it and say, you know, I'm really sorry about that. Can we start over? And so again, being supportive and checking in with each other is really important. Before I quit, I wanted to just make sure I've challenged people throughout COVID, as the governor has had me come over, to make sure you know what the signs of mental distress are. Many people can identify the signs of stroke, the signs of a heart attack, and it's really important that we all recognize signs of distress. So, withdrawal, so people are socially different. Agitation, you're noticing the anger and the stress and the frustration that I just talked about. Change in your daily routine. So, you're eating, sleeping, exercising, all of those routines may be changing. Hopelessness, you just can't see out the other side. And change in personality, where you might experience joy. It's just like I said earlier, so-and-so's not just themselves. They're behaving differently. And so when you see those, call that out to your family, friend, or loved ones. And I want you to know that there are so many helplines and providers that are available. Providers have done a fabulous job across the state. They are still open for business and serving people. So start with your healthcare professional, talk to their nurse. If you're experiencing any of these signs or frustration, anxiety for more than several days, really please reach out. When we are coping and we are recognizing together, we'll be healthier, the people we love for will be healthier, and our communities will be stronger.
Great, thank you very much, Sherry, I appreciate that. All right, so now we're going to be talking about our CARES Act program. You may recall earlier this year, when the federal government gave the state of Nebraska a little over $1 billion, we had a program to be able to help out our business stabilization grants, our Community CARES Act, and so forth. And we're going to be going over the update on where we are with that program and announcing today a new round of programs that will be available for folks to be able to help get through this pandemic. I also have our CEO of the Department of Health and Human Services, Danette Smith, with me today, and she's going to specifically be talking about the Community CARES Act. And then, of course, we have the PowerPoint presentation up here, and I believe the reporters are getting a physical copy of that as well. Paul, so you got one there. And so we're going to be going over this. Again, please bear with me. This is going to be a lot of information in a very short period of time, but we'll have time available for questions here at the end. So first of all, let's just cover where we were today, where we've been in the past. So you may recall that we had our Community CARES program that was $85 million, and that was going to a variety of organizations that help take care. Sherry was talking about the organizations out there that are providing mental health care services. They were some of the organizations that were available to get these CARES Act funding. So that was the $85 million. And then for businesses, we had the $392 million, $230 million for small business, $100 million for the livestock producers, $40 million for our rural broadband effort, $16 million to help people get their skills upgraded through our community college system. We had $1 million there to be able to help some of our businesses that are, let's see, that was our Gallup program, right? To be able to help companies get trained up and see how they adjust to the new environment. So really get some resources there to help small business think about how they do their business differently. And then, of course, our administrative costs as well. Then we said we're going to hold $427 million for the Unemployment Insurance Trust Fund. And so we wanted to make sure we keep that out. We had state government getting $80 million and then $100 million for local government. So that all came to that $1,084 million. Now, let's just bring you up to date on where we are with regard to the utilization of those funds that we allocated. So let's start here in our first line with regard to the whole community cares. You can see for our first round of grants, stabilization grants, we had $40 million allocated, $11 million were utilized. For the program we have right here with regard to these grants, we had $43 million set aside, $36 million were used. For our Healthy Places, we had $2 million set aside, $331,000 were utilized. Here in the Grow Nebraska, the agenda that we had for, again, business stabilizations, we mentioned the $230 million for the business stabilization grants, $129.5 million were utilized for that. For the livestock producers, $100 million, nearly all of that at $98.4 million was utilized. For our scholarship programs to pay for that skills upgrading, $11 million of the $16 million utilized. For our next program here with regard to the rural broadband, we had $40 million set aside, $29 million was utilized. We were able to use the whole funding for the Gallup program. And then of our administrative costs we set aside, so far $1 million have been used. So what that means is we've got additional dollars that have not been utilized so far. And with the CARES Act, all these dollars have to be utilized by December 30th, or they are returned back to the federal government. So what we're announcing today is a second round of grants that will be available for folks so that they can take advantage of the program that we have here at the state, funded by that federal CARES Act money. Now, some of the feedback we heard was some people didn't hear about this program. Some people didn't think they qualified, so they didn't apply. So we really encourage people to get the word out, talk to people, make sure people apply, and see if they can take advantage of it. All right, so first of all, let's just talk about state and local government and the money we had utilized. Oh, sorry, this is still more of the utilization money. But what we've done here, state government, we set aside $80 million. We had $71 million expended of that. $36 million of that was actually PPE that we provided to local entities, local public health departments through them, to first responders, healthcare workers, long-term care workers. So that's $36 million there. For local government, we had set aside $100 million originally, and then budgeted $130 million. Really only about $10 million of that has been utilized so far. And that's in part because we're directing all those government entities to go to FEMA first, because we can get reimbursed 75% on that. But we got to make sure that that's also available to be able to get out. And then for the Unemployment and Trust Fund, we have put almost $250 million in that so far. All right, so phase two. For our Community Cares program, we're going to have nearly $50 million, and Danette Smith is going to talk about that. The Hospital Capacity Program we announced on Friday, that's the $40 million to help with our hospital systems staffing, so for nurses, respiratory therapists, screeners, that sort of thing. So those grants will be going out to those hospitals. We talked about that on Friday, so I'm not going to cover more of that today since we've already done that. Next, with the Grow Nebraska Part 2, again, this will be along the lines of our business stabilization grants, another nearly $150 million here to be able to help out those businesses. We're going to get more detail of all this stuff in a moment. State government, $100 million, and local government, we're going to be expanding the support to help them reach the $130 million that we have budgeted for that. All right, so I'm going to now call up Danette Smith to go through the program with regard to the Community Cares Act and the nearly $50 million we have there. So Danette, will you please come up and walk us through that part of the program?
Thank you so much, Governor, about having us here. The Department of Health and Human Services is excited, believe it or not, about our second round of our stabilization grants, or what we call community cares. This is going to be, the first half is going to be an application process. We will be reopening the stabilization grants for charity organizations and licensed providers, and that monies will be allocated to $29 million. The minimum will be given $12,000 to those charitable organizations and selected DHHS licensed care organizations. You remember from last time we focused a lot on areas of disproportionality. We're doing the same thing this time. For those that are where the communities they experience disproportionalities and impact by COVID-19, they will receive up to $27,000. So how did we get to looking at those areas? Well, we did the same thing we did in round one. Those areas are determined by per capita of COVID case rates as of June 30th, 2020. This is the same metrics that we used for the first round when we did the funding in July. If organizations received funding early this year, that's in July, of round one, they are not eligible to apply. The only exceptions are our assisted living facilities. They can apply again, and we're also going to be including long-term care facilities. These are two providers that we know have been particularly hit very hard with the pandemic. These facilities will also receive higher levels of funding, and it will be based on licensed bed capacity. The stabilization grants application will open at 10 a.m. on Wednesday, October 21st, and close on Friday, November 13th. Again, I want to draw your attention to our website, coveris.nebraska.gov, for more information. Please look at that website. Secondly, we'll be reopening Healthy Place grants for centers of worship. $500,000 is the total amount. Those grants will include 1,500 grants for centers of worship to purchase PPE and cleaning supplies. If organizations receive funding earlier this year in round one, they are not eligible to apply, and here's why. DHH plans to send supplemental payments to those round one centers of worship guarantees, bringing them up to $1,500. And I'm going to repeat that again. If the organization received funding earlier this year in round one, they are not eligible to apply. DHHS plans to send supplemental payments to round one centers of worship guarantees to bring that grant up to $1,500. Many of our grantees round one received $500. They're going to go up another $1,000. That's simply what I'm saying. Healthy Place grant applications again open at 10 a.m. Wednesday, October 21st, closed Friday, November 13th. Remember, this is an application process. Next slide. We talk about new direct payment grants. New direct payment grants. DHHS is working directly with a number of organizations and providers who offer food, shelter, childcare, and other important services to Nebraskans. Response and recovery grants in the amount of $2.2 million, additional funding to serve grantees who were awarded funding in round one, which means we're going to supplement them a bit. Additional funding will focus on projects significantly dedicated to distributing emergency financial assistance such as food, rent, utility assistance, and those that address needs of communities of color. For example, Food Bank Stabilization Grants will receive $11 million from us, funds for the Food Bank of the Heartland and Food Bank of Lincoln, who manage statewide distribution of more than 200 local organizations. Number two, Child Care Stabilization Grants in the amount of $1.5 million, supplementing payments for children who have to receive child care through our subsidy programs and to our subsidy providers who serve our most crucial workforce to allow our parents to get back to work. Number three, Housing and Shelter Stabilization Grants, $3.3 million in funding to organizations across the state who provide eviction prevention and other housing security assistance. Again, I want to call your attention to our website, and that website is coronavirus, COVID-19, .nebraska.gov for more information. And I think this next slide goes to talking a little bit about the hospitals, and I know that the governor is going to speak a little bit more in detail about that. Thank you, Governor.
Thank you very much, Nanette. All right, so again, we talked about the hospital last time, $40 million for staffing. Again, we mentioned nursing, respiratory therapists, screeners, hazard pay. These are the sorts of things that we're going to be giving the grants for with regard to our hospitals to be able to help out, to make sure that they've got the staffing available to be able to take care of folks. Since we cover this on Friday, I'm really not going to go over any more of this today. So if we can go on to the next slide, Lucas. All right, so Grow Nebraska 2. This is a follow-up to our previous Grow Nebraska through the Department of Economic Development. And it's going to be starting with, again, the business stabilization grants. There'll be $12,000 grants, similar to what they were last time, $25 million. And that FCFS means first come, first serve. So similar to what Danette was talking about, these grants will be eligible to be applied for on Wednesday, October 21st at 10 a.m. So please help spread the word there. Wednesday, October 21st at 10 a.m. You can start applying for these $12,000 grants for small businesses to be able to help get them through this pandemic. So the next line is specifically for restaurants and bars. So in the previous program, restaurants and bars were part of the overall business stabilization grants. We are actually breaking them out separately in this round. So we've got the first round for small businesses up here, 25 million. We have a separate category just for restaurants and bars because they've been impacted so much by this pandemic. And we're setting aside $20 million there so folks can apply for that. Now, you'll notice this line down here that if you did not participate in the first round of the funding, that was $12,000, and you are applying now as a restaurant and bar, you will be eligible to get $24,000. So if you received the funding in the first round, you'll be able to get $12,000. If you did not apply in the first round, you can get $24,000. So just, again, please get the word out to folks that can apply. We heard a lot of folks that they did not apply first time around, that their restaurants and so forth are struggling. Please get the word out to them that they can apply, again, starting Wednesday, October 21st at 10 a.m. So our next program here is going to be similarly targeted to a group of businesses that have been disproportionately impacted here, and that's our a cosmetic, massage, and body art. Again, first come, first served, $20 million, or $22 million rather, $12,000 grants. So again, for folks who may not have applied, but please get out there, apply for this round, breaking that out separately. Then another group of businesses that, as we've gone through this, we found has been disproportionately impacted is going to be our event centers and sports arenas. We've set out $20 million out of the new funding to be able to target them directly, up to $500,000, and that will be based on seating and their just overall square footage. So we're going to do the grants to those facilities up to $500,000 based on their size. So that's basically what that's breaking down to with the seating and their square footage. And then another $34 million is going to be going to our hotels and convention centers. Similarly, we're going to be allocating it based upon their size, meeting space, and number of guests. So we're going to be breaking it down that way. But again, if you want to think about it, getting back to size, $500,000 grants for them based upon that. Let's go to the next one. So ethanol producers, again, another industry impacted because demand for driving had gone down. Our ethanol producers were impacted, so we've set aside $15 million for our ethanol producers. And again, those grants will be based upon their faceplate capacity. So again, getting at kind of the size of each of the facilities, discerning out the money based on that. Then zoo stimulus. So we know, for example, tourism has been down, dramatically impacts the Henry Dorley Zoo, the Lincoln Children's Zoo, and our Riverside Discovery Center in Scotts Bluff. So we're setting aside a little over $6 million for those zoos to be able to get some help getting through this pandemic. Movie theaters have also been impacted. Movies have been delayed, release has been pushed off. That's been impacting our movie theaters. Even those that are open are struggling because they don't have enough titles to be able to display. So we're setting aside $3.2 million there, and it's basically going to be, again, based on size, if you want to think about it that way, $10,000 per screen. So $10,000 per screen, we'll be able to cover the movie theaters to get to that $3.2 million. And then, because again, we heard a lot of folks last time didn't hear about it, didn't get a chance to apply, didn't get the time to apply or whatever, we're putting aside $1 million to help educate, communicate, advertise that this money is available for people to apply, again, starting on Wednesday, October 21st at 10 a.m. If you want to keep saying that over and over, the website will be available at that time, coronavirus.nebraska.gov. So, again, just kind of hitting on the timeline here. Applications open 10 a.m. Wednesday. Application period will close on November 13th. That's a Friday. So you've got a few weeks here to get that application in. And one of the reasons why we're going to be advertising this, to make sure people are aware of it, we've got to get those applications in. First come, first served basis on many of these. And then finally, the expenses have to be out the door by December 30th. That is a requirement from the federal government with regard to the CARES Act money. So that's what that is about, making sure we get those dollars out. To date, we have expended about $591 million of the $1.084 billion that you saw there. So we've got some work to do to get this out the door. We're encouraging people to apply get those applications in so we can get those dollars out the door to those folks who need help getting through this pandemic. So, right, we got to get into the local government part of it. All right, so we're expanding the eligibility. You may recall that we had expanded the eligibility earlier this year with regard to local governments to cover the March through May 31st expenses. We are now expanding that category to include our dispatchers, corrections officers, and public health staff. So more information will be available, provided by NEMA, but just again, what that will do is help us get to that. We'd originally said $100 million, we budgeted $130 million, we paid about $10 million. This will help us get to that total of $130 million to local government, help get that out the door to them by doing this. And then finally, state government, additional support for state agencies to reimburse for eligible expenses, similar on the categories here for dispatchers, corrections officers, and so forth. And then finally, setting aside about $28 million for the Unemployment Insurance Trust Fund. And that number may go up depending on the utilization of these other programs that we've got there. All right, so before we get into questions on that, I'm just going to highlight that we've got a news conference tomorrow at 1 p.m. And then that's going to be here. And then we have the Spencer Bridge celebration opening Thursday at 1 p.m. And so that's the final bridge of our 27 bridges that were taken out by the floods last year. We got our last one that's going to be opening up here on Thursday. So we're excited by that. So with that, I know we covered a lot of information, especially on this CARES Act program in a very short period of time. Let's go ahead and take questions on that. Well, actually, usually, Taylor, we do questions that were texted in. What? There were no submitted questions, so now it's just folks in the room. We're available to take questions. Paul, we're going to start with you.
Were there any glaring gaps that you saw in the first round that we're trying to remedy with the second round?
Well, I think what you see, so Paul's question was, were there any gaps that we saw in the first round that were trying to be addressed in the second round? So actually, Lucas, can you go back to that slide that talked about some of the specific programs? So when you're talking about, again, bars and restaurants, we saw that they were being particularly impacted. We saw that, again, cosmetic, you may recall specifically, this was a group of companies that we actually did close down for a short period of time. We saw that they've been impacted. We saw that our event centers have been impacted. We saw that our convention centers have been impacted. We saw the ethanol plants were impacted, movie theaters. Every area where you see a separate line item above just the small business grants, that is an area where, as we've been going through this pandemic, we've seen there's been an additional need. Zoos was one of them. We talked about the movie theaters. So yes, anything that's broken out separately, Paul, is an area where, as we've been talking to industry, there's been special need in these areas, so we've targeted those dollars for them.
But if they were eligible before and didn't apply, why is that?
Well, you may recall that our original program was really targeted at small businesses. So if you're talking about like event centers and convention centers, they may not have qualified under that program because they were too big. Right, exactly. So, for example, and you see the grants are bigger. So if you go back and look at what we're doing for convention centers and for our event centers, we're doing grants up to $500,000. Again, you may recall our first round of small business grants were for $12,000. So again, recognizing that we've got larger organizations that have been impacted, they've got greater needs. These grants are larger grants to be able to help them out.
Just to be clear, which ones of these are new? They're now eligible, they weren't eligible.
So really, when you get past down to the events and convention center, that's new. The arenas are new, or the arenas and convention centers. Ethanol producers are new, zoos are new, movie theaters are new. And then for the community cares, as Danette wanted me to point out, the long-term care facilities, the assisted living and the nursing, skilled nursing, those are new as well.
And just to be clear on the livestock producers and the small businesses, if they got it in the first round, they can get this second round. This is a brand new.
So yes, that's correct. So if they were eligible in the first round, they can reapply in the second round.
And they apply with whom?
So that, again, you can go to coronavirus.nebraska.gov to get information, or the Department of Economic Development also has it on their website. Follow it there. Yeah, Andrew.
Is there any
So the question was, are we looking at companies that have been doing leasing? That is not part of this unless they fit into one of these other categories with regard to a small business or something like that. If they were in that small business category, then they would be able to apply for that specifically.
Is that very much of a concern, or is that something you'll be looking at in the future?
So the question was, is that something we may look at in the future? We may, but given the short time frame, it's unlikely that we're going to be able to do anything for those leasing companies. And again, as we've been going through this, the areas that we talked about here were a higher need with regard to that.
Are you rethinking your decision not to expand the food stamp benefits that were out there?
So the question was, are we rethinking the maximum allowance under the SNAP program that the federal government had earlier? And the answer is no. We actually, again, August numbers were back to about normal with regard to the number of SNAP families and individuals that were on the program compared to September of last year, so that's not part of this.
Governor, Dan wanted to clarify, restaurants and bars are eligible for a second grant, but
Oh.
They're the only ones, not the rest. Not
Great. Thank you very much, Taylor. I'm sorry, I misspoke there. So the restaurants, bars, and hotels are eligible to get the second round of funding. If you got it in the first round of funding, you're not eligible this second round. Is that right, Dan?
That's
Okay, great. Sorry. Thank you very much. Yeah, Andrew.
And is that enough for some of these businesses? I mean, it couldn't seem like, is that enough to keep them afloat?
So the question was, from Andrew, was like, is this enough for these, to keep some of these businesses afloat? And obviously, every business is going to be different. And what we're doing is trying to make it a program that we can make it eligible for as many businesses as possible. And, I'm sure there's going to be greater needs than what we have outlined here, but we've got to manage the resources that we have to be able to cover as many people as possible. Yeah, Andrew.
And so you have about, how much left of the 1.25 billion?
So, well, remember, the overall number that the federal government gave Nebraska was 1.25 million, but Douglas County got their own piece of that, about 160 million of it. So we don't have, so that's not part of what we're talking about up here. What we're talking about is the $1,084 million that the state of Nebraska received directly. As I mentioned, we have spent about 591 million of that so far, and with this program, that would take us up to that $1,084 million.
Are grants to houses of worship consistent with constitutional separation of church and state?
So the question from Fred Knapp was, are the grants to houses of worship consistent with the constitutional prerogative of separation of church and state? And I think that separation of church and state is maybe sometimes misunderstood. What that says is not that, what that clause in the Constitution is about is that the state of Nebraska will not promote a state religion, one religion that everybody's supposed to do. It does not mean that religion isn't supposed to be part of the public square or that they can't receive assistance. So since we've made this broadly available to religions who are out there to be able, the houses of worship to be able to apply to this, we're not picking one over another. So it is absolutely in line with the Constitution. Yeah, Jim. Okay.
A restaurant, if they are eligible for a $12,000 grant, does it actually mean it could mean 10,000, it could mean 5,000, it could mean automatically 12,000?
So the question was, with regard to the grants to the restaurants, they're eligible for the $12,000 grant. Could that be a less grant? And Dan, my understanding is it's a $12,000 grant.
It's going to be $12,000 grant. I think the wording came in at up to 12,000, just in case it's slightly less, but it's 12,000.
Yeah, so it's a flat $12,000 grant. Thank you for clarifying that.
If one area doesn't apply for all the money that's allotted, will that then go to another area?
So the question is, if we do have underutilization in some of these areas, what will happen with that? And that's where we'll be saving what kind of the additional money for that unemployment insurance trust fund. So that will have the ability to put it in there. Andrew.
Can you go back to the hospital, hospital?
Can we go back to the hospital slide?
Yeah, the question that somebody had asked me was, those transfers, does that include just COVID patients, or if a hospital is transferring a patient, into another system, in their system, I guess for any type of there for gallbladder or something like that, and she gets moved to another hospital, does that include transfer, or is it just transferring COVID patients?
So with regard to the limitation we put on hospitals to be able to do elective surgeries, it's really about transferring COVID patients. We want them to be able to serve the coronavirus patients they've got. If they've got a hospital system and they're, as part of the normal course of business, just transferring patients around, that is fine. Paul,
Can we ask some questions on some other issues?
you want to move on to other topics?
Well, I was gonna ask about Test Nebraska.
Sure, Test Nebraska.
So I got a test over the weekend, and I already got my results. I was told I'd have them back in 1 to 3 days. I talked to somebody who got a test in Omaha, they said they'd get them back in 3 to 5 days. Why is that?
I'm sorry, say that again?
Somebody got tested in Omaha, and they were told they'd get them back in 3 to 5 days. I got my test in Lincoln, they said I'd get them back in 1 to 3 days. What's the difference? Why would they be?
Yeah, so what Paul's relating is that he got tested here in Lincoln through Test Nebraska and was told he'd get his test results back in 1 to 3 days, which is the standard that we're telling people is that it's the 72 hours we're trying to get it back. But somebody went in Omaha and got told 3 to 5 days, and I'm not sure why that person was told that. They should not have been. Our goal is to get these tests turned around in 3 days, and my understanding, again, is since the 13th of October, we've been getting them turned around in 48 hours.
And I know you talk about contact tracing. How many contact tracers do we have working right now?
So,
They're on reserve.
the question with regard to contact tracing, and Dr. Antone is not here today, unfortunately. We've got 218 that are at the local public health departments, and I know that we have about 1,000 at the state of Nebraska. Now that includes some of our reserves. So, for example, we've got 275 people that are trained in the Department of Health and Human Services that are back at their day jobs right now. The last data I saw was that we had about 400 that were actively working through companies like Nelnet at the state of Nebraska that were able to supplement those public health departments. And, but I'll have to get you updated data on that unless, Danette, you know, I've got it. So it's about 400 people right now. So overall, if you look at all the people we've got trained, we've got about 1,000 people at the state trained, but right now about 400 are being engaged.
Why aren't all of them being engaged if our virus level is so high?
So the question was, why aren't they all being engaged right now? And again, it gets back to the demand. I think there's, a lot of work that's being done at the local public health department. I know that, for example, Douglas County, Audie Port uses us, I think, almost exclusively. But the other public health departments really haven't adopted that yet. I think what you're going to see is as their caseloads grow, they're probably going to be, at least they've told me anecdotally, they're going to start using Test Nebraska more. Or not Test Nebraska, or contact tracers more.
The state's contract.
The state's contact tracers more, yeah. Yeah, Andrew.
There's been a couple of reports recently of some, people had Trump signs, Trump flags that have been vandalized. I guess their homes or some of the property has been vandalized. I guess, have you heard about that, and what's your reaction to that?
So Andrew's asking about the reports that people who have Trump signs up are being vandalized. I know we had a case, and it's certainly not documented yet here in Nebraska, though, that some combines and farm equipment that also had Trump signs up were caught on fire. That's still being investigated, whether or not that was arson and so forth. And then I know we had a case, there were some cases down in Kansas where Trump supporters were actually assaulted. And again, I think that, again, folks, we got to remember that we got to live together here. We may have differing opinions about whether you're a Trump supporter or a Biden supporter, but it is absolutely unacceptable for Trump supporters to be targeted or Biden supporters to be targeted, that we can't resort to violence here. This is just completely unacceptable and really anti-American. The people who are doing that are anti-American. These are the people who truly, don't understand our country, don't love our system of government, our republic, our Constitution. These are people who hate our country if you're doing those sort of things. You cannot do that and think that you're living up to the ideals that our founders had for what this country was supposed to be about. So I just call on people, look, we're going to disagree, and again, we were talking about it earlier. Due to the pandemic, people's tempers are short. But we got to remember that we still have to treat each other with civility with regard to however we're going to disagree, whether it's going to be over the issues with regards to the campaign or other political issues or whatever, we've still got to work together here in society and do it in a civil way.
He was time for a final question.
Yep. Okay, well, yeah, go ahead. Since you haven't asked one yet, you get to go do it. Go ahead.
So the CDC has guidelines for states to submit their vaccine distribution plan. Did you submit that, and can you tell us what that looks like?
So the question was, the CDC wanted us to submit our vaccination plan by October 16th. Did we submit it? Yes, we did. And Danette, do you want to come up and talk about what that vaccination plan looks like, since this is your department?
Sure. So there are several areas where
Danette, can you come up here with the microphone?
Sure, there's a couple of areas that we're focusing on in our vaccination. One is we're looking at when the vaccinations come to us, how they'll be stored. That's number one. We're looking at the vulnerable populations. The CDC is guiding us to prepare for what they call the first responders, and so we're looking at those particular people as the people who would get the viruses, the vaccinations first. And then we're also looking at community providers who are going to work alongside of us in being able to distribute and administer the vaccinations. The fourth thing is also a communications plan. How will we get the word out to the community about the vaccinations? Who will we be working with to get that word out so that the community is aware at large about the vaccination? There has been some discussion about the type of vaccinations that might be out there. There's still not clear information on that because it's still in the testing phase right now, but we have submitted our plan. It is on time, and we look for more feedback from the CDC on the plan. And thank you.
People who are incarcerated or juveniles who are in custody?
So those are considered some of our vulnerable populations. We will be looking. Andrew asked me about vulnerable populations, such as juveniles and those persons that are in corrections, if I'm not mistaken. My response to that is that, yes, we are looking at that group as one of our vulnerable phase 1 populations as we look at the emergency response people first. Okay.
All right, thanks,
Thank you.
All right, folks, thanks again for being here. Again, I want to thank the folks from No Footprint Too Small and the Knights of Columbus and Hebron for joining us, as well as Danette Smith and Sherry Dawson. Thank you very much for joining us. Again, a lot of questions about this. I know Taylor will be there available to be able to help unpack some of the details of our second round of community cares and our small business stabilization grants and so forth. And then just a reminder, again, we'll have a press conference tomorrow at 1 p.m. and Thursday at 1 p.m. up in Spencer for the new bridge that we're opening up there. Thank you all very much, and have a great week.